I welcome you all to this implant seminar. Thank you for coming in. So today I'm going to talk about dental implants. Every one of you must have heard about it. What are they? We're just going to go in detail, and also after my talk I'll show you the video, the animation video, which will also explain in more detail about dental implants, and then whatever questions you have, you're welcome to ask me. Okay. So first thing you want to know, are missing teeth causing you miss out on your life? When you have a missing teeth, first thing which affects us is if the front teeth are missing, then it's about our looks. If the back teeth missing, then it's about chewing function. Also it affects our psychologically and causes, especially when you have more missing teeth, you cannot chew properly, and that can lead to nutritional deficiencies, and it can affect our own general or physical health. So missing teeth can affect both physically and mentally. Now, what are the other effects of missing teeth? Now, whenever we have teeth in our mouth, our face is supported, like our lips are supported. You can see the profile is good. You can check this, just keep this profile in mind, and this is like showing the lower jaw with the teeth in there. Go to the next one. So when you are missing teeth, you see the bones started rounding up here, and you can see the effect on the lower lips and the upper lip. It's kind of sinking in. Now after some time, when you have missing teeth, it leads to bone loss. What it does is premature aging. Your whole facial appearance is affected because we lose our muscle tone because of the absence of teeth and absence of bone support. So now, what are the options to replace this missing teeth? Basically, first option is to do nothing. We just let it be. But that it can lead to loss of chewing function. Again, if the front teeth are missing, then it affects your appearance, and also the bone loss, which is very important. The traditional option is to replace missing teeth is by doing the bridge. Like if you have missing tooth here, what we do is that we go and shape this neighboring two teeth. We make them smaller, we drill on them and make them smaller, and then make a bridge which goes on those two teeth, and it's cemented to it. Now, of course, it will replace your missing tooth, but what we are doing is we are affecting neighboring two teeth. We are cutting them down, which is not good, because in future, one of these two teeth may get cavities, and you may end up needing some other treatment called root canal, or you may end up losing this tooth. And then what we do next? Then we go and prep this tooth and make a bigger bridge, and the cycle goes on. So the bridge is not a very good option, and then traditionally, over the span of 10 years, 1 in 3 bridges failed because of the cavity. So also, it doesn't take care of the bone loss. You still get the bone loss. The implant option. Now, implant, what we do is that we don't touch the neighboring two teeth. Implants are like a man-made root which you place in the bone and the gums and put the tooth on it. So also, the implant is the only one option which can prevent the bone loss. Basically, how it does it, because when you chew on this tooth, it transmits all the stimulus to the bone to be maintained. It's like when you have your leg on cast and you don't use that leg, so you see the shrinking of the muscles because of the disuse. Same principle here. When you have implant in there, it sends all the functional stimuli to maintain your bone. Either in a bridge, or when you don't replace that tooth, you don't get those stimuli, and then of course the bone which doesn't go. Now, for which people we can do implant? Almost everyone can have implant, of course, unless they are children or growing adults, because when your jaw is growing, it's kind of, if you place an implant at that point, and your jaw keeps growing, the tooth may be misplaced or out of place. So, as far as the health is concerned, anybody who is healthy or in a moderate health condition, we can place implant for them too. anyone who has like severe health condition, of course, that has to be attended first. But we can talk to that person's physician and discuss it and then have a treatment approach. So what does implant look like? This is a picture which shows a comparison of tooth on one side and the implant on the other side. The normal tooth, the natural tooth, has 3 layers: enamel, dentine, pulp, the gum tissue, and the periodontal ligament. This is the ligament which attaches the tooth to the bone. On the other side, implant has 3 parts. This is the implant. Now this is the golden part you see. It's a connection of the implant to the outside called an abutment, and on which we put the tooth. We'll explain in detail when we go further, but basically there are 3 parts: the crown, the abutment, and the implant. This is the part which is the root, which anchors into the bone and which supports the tooth and the abutment. What are the options for single tooth replacement? If you have one tooth missing, how we go with the treatment on this? Basically, this tooth is missing, so what we do, go ahead and do it, place an implant in this area. So that's the implant going in, that is between the gum and the bone. Yes. Now this is what I was talking about, the abutment, the gold part, which connects to the implant, and it is kind of extension of the implant outside the gum. Implant stays below the gum line. The abutment, which is this gold part, which connects to the implant, and stay outside. And on this, you place a crown. So that's the crown here. Of course, this is just for the representations. You can see abutment and the implant, but in real life, the crown covers everything. It doesn't show through. This is just for representation. Now, when you have multiple missing teeth, now that was for one missing tooth. When you have 2 missing teeth, then of course you place 2 implants. Same procedure. So we have 2 implants going in. Again, 2 abutments and 2 crowns. Now this is multiple missing teeth. Now what if all the teeth are missing in one jaw? What do we do? Now, it doesn't mean that we have to have one implant for each missing tooth. Basically what we do is that we place like 5 to 6 implants. So these are the 5 implants going in the bottom jaw. Now this is instead of those abutments which you saw previous implants, we place a bar which connects to all the 5 implants, and each bar has like a ball connection on the top. Now this ball clicks into the inside of your teeth. It's like a ball in socket. So that's what arrangement is here. So these 5 implants are supporting row of lower teeth. Now the option which we showed you previously, that was removable. You can remove that and place it in, but when it is inside your mouth, it's very snug. It won't move. It's just whenever you want to take it out, you can take it out. Now this option is fixed teeth, where again you place 5 implants, and this time you screw the bridge onto the implant. So now this is fixed. You cannot take this one out. Only dentists can do it to clean it. The previous one you can take it out and clean it. That's the advantage of removable processes. The fixed processes, the disadvantage is you cannot remove it, but fixed itself is an advantage because everybody wants fixed teeth, nobody wants to remove it. Now, say if you don't want to do all the 5 implants, you already have a denture and it keeps moving, how do you stabilize? So we can use sometimes only 2 implants to stabilize your denture. The way it works is, again, we place 2 ball abutments on each implant, and again it clicks inside of your denture, so your denture is stabilized, it won't move. Okay? But this still, always 5 implants are better than 2 implants. It's like sitting on a 4-legged chair, 3-legged, 2-legged, that's the way it is. So this is removable, yes. But it's only 2 implants. So it will support, like you have 5 implants, it's better. But 2 is still, it will help you. It will keep your denture stabilized, it won't move. So that was all about the implants. Now we're going to play the video, and that will show some animation, and it will give you more understanding about the implant. And after each video, whatever question answer you have, we can talk about that. Okay? Please.
Dental implants replace missing teeth. The design of a dental implant is based on the design of a natural tooth. A natural tooth is one piece commonly described as having two main parts. One part is the crown that sits above the gums. The second part is a root that sits securely in your jawbone.
So you're giving, so you can have teeth on the same day, but you have to give up that 10% success rate.
I wasn't going to go for that one, but it's just too far-fetched
Yeah.
to be true.
No, we also do by one few of our patients, they want, like they are living abroad, they want a teeth on the same day, they can't come back. So we give them, yes, but as far as they know that there is a 10% higher chance that this implant can fail.
I want guaranteed success.
Yeah, so then that's why for 6 months, why give up 10 to 15 years of your life? Okay, so you all do this one? Oh, sure.
No.
No, I was going to say,
Yeah.
the titanium implant,
Natural
so
teeth.
you don't, it's just put in the hole and the bone has to grow into it. You don't
Yeah,
put threads into the bone.
Exactly, yeah. You have to prepare the bone, yes, you have to do it. And even though it has got threads, it looks like a screw, but it's not the way it anchors into the bone.
Okay.
Bone has to grow
Has to
onto
grow
it.
into it.
In initial stability, yes. The first initial when you place an implant, it stabilizes by those threads. But after 4 or 5 months, the bone has to bond to that implant. And that's the way it stays in. You cannot rely on those threads for a lifetime of the implant.
You need a bunch of implants. Can you do a little bit at a time, or does it has to be done all?
You can stage it down. Yeah. You can stage it down.
Will there be any bone rejection that won't grow around the grooves?
In my experience, I haven't heard of anybody having the rejection of the implant in the bone, but in literature, yes. There is like 0.1 to 0.5% chance that there can be rejection, but it's very, very rare. And most of the time, the rejection is because of not proper procedure, not because the bone didn't accept it. Like when you do the surgery, this surgery is very technically demanding. It's a very conservative surgery. It's much less aggressive than taking a tooth out. So even though it looks very traumatic, but it's not that traumatic. But it's very delicate. You have to be very technically challenged to do that. So if you do it properly, the implant will last.
Natural teeth are held secure.
You know, realistically, what are you going to spend for that?
It depends upon how many implants you're putting in there. Like this is fixed, this is a fixed teeth. So usually if we put for this option maybe 6, minimum we need like 6 implants. So you're looking at expense of, I'll give you a range around $10,000 to maybe $20,000.
The insurance cover these kind of things?
Some of the insurance they do, but not all of it. They will pay a little bit towards it. Yeah. So it depends upon what kind of insurance you
This
have.
kind of things is like not removable.
Yeah, this is not, there are 2 types in the denture. One is removable, other is non-removable. Usually removable is a little bit a lower cost, fixed are higher cost, because for fixed you need to place more implants.
The removable, you need the first one